otherwise picked. Oops, that I might have otherwise picked, except that actually when we chose these books, this book came out last year, and it was during the time that Omicron was flaring again. And I really thought it was important for us to talk about just what the whole global health perspective would be about pandemics, right? Because this is not going to be the last, the last infection that we're going to see happen in the world. And I don't know if you know anything about Eugene Richardson. Do you know anything about him? Okay, so
No, and I've asked other people, because I was just at the beach actually with Pam McMichael and some other people from the Highlander Center, and they weren't familiar with him either. But some of the terms were difficult for me because I'm not familiar with the health terms. But I wasn't surprised, shocked. I was shocked kind of to see, oh, these really are the facts, because it was, I already kind of thought that's, what was going on.
well, I don't even know that most of this was about health. I mean, most of what was so difficult was that mostly he's talking about philosophy and anthropology, and he talks about hegemony all the time, and he talks about neoliberalism, and so a lot of these terms, colonialism, coloniality, and he does explain them. But I have to tell you that, after I had picked it, I actually picked it partially because Paul Farmer had written the foreword. Now, Paul Farmer is probably better known to the Highlander people. And I'm just going to ask, who is on the iPhone? I know if you're in your car, you're probably maybe not going to be able to unmute, but I was just curious who that was. Are you still there, or is that a different, can you speak or not? Because then I wonder who the iPhone is, but that's okay. I want to make sure.
I saw a picture.
Oh,
I mean,
so
I did see, and it looked like a woman in her car.
Okay, well, if you can talk, that's fine. Otherwise, no, I do want to say that there are some very important points in this book that I think we ought to discuss. It was a lot harder to read this book than I thought it would be, because he's not linear. He just moves around so much, and he uses terms some of like the modalities, and that was about public health. Some of these modalities that he talks about that I had never heard of either. So it's not like you learn this in medical school. But he met, and so since that book, and I started reading it, I have listened to him speak. He is at Harvard. So let me tell you who he is. He got his undergraduate degree in biology from Duke, actually.
I saw Duke mention, yeah.
He then went to medical school at Cornell. He then immediately, I think, went on and got his PhD in anthropology from Stanford. And his own, so a lot of this I learned because I went on the Harvard, they did an interview with him because he is part of the global health department at Harvard, and Paul Farmer is the chair there. And Eugene Richardson worked, and you saw that in the book, he has worked with Ebola, in Africa, and that's where he's been most of the time when he was working with, with other countries. And he now works with Partners in Health, which is actually an organization that Paul Farmer started. And Paul Farmer has written several books, and he has worked in what Gene Richardson calls the global South. I had never heard that term used like that. I don't know if you had, but so he separates the world into the global North and the global South, right? So there is an 1.5-hour presentation that you can watch if you want to on YouTube that was, I think, from sometime in the spring of last year, that's from Harvard, where he did a presentation to the people at Harvard. And then there's also a panel that's very interesting on YouTube that he did with several people. One is Paul Farmer. One is a woman who is a pediatrician from Rwanda, who has now, apparently, they've now started a global health medical school in Rwanda outside of
Wow.
this town where she lives, and she's the vice chancellor, and Paul Farmer is the chancellor. And so she speaks, and then there is a gentleman that is speaking about reparations. And so he's involved in figuring out what it would look like to do reparations for all of the injustices that have occurred here in the United States.
Mm.
Now, so right now, Eugene Richardson continues to work with Partners in Health. He's on the faculty at Harvard. So, people asked him, and rightly so, well, here you are, and in this environment, and you are talking about how awful how we are all corrupt, right? So how do you see yourself here at Harvard seeing that? And he goes, well, of course, I have to recognize where I'm coming from and what our paradigm is. But he meant it to be provocative. He meant this book. And he also said, I wrote this book in a scholarly way because I wanted to be taken seriously. This is not a book. And I realized that because I hadn't read the book when I chose it. I had only read about it, and I had read Paul Farmer's foreword. So then I thought, after I started reading it, oh my gosh, but by then we'd sent out the flyer. Plus I thought it was an important thing, but I wish more people were going to be on here, but they probably took one look at that book and started reading it and thought, oh my gosh, I can't get through this. I mean, even other physicians said that. This book is hard, it's hard to read. And so he said, I know it was meant to be scholarly, to be taken seriously. And I will at some point write a book that is more for the public. But and he tells you right up front that everything is about ideology. And his ideology is, and he'll say it, radical social equity. And he gives the whole history of how, and people keep asking him, well, how did you get on this path? Right. And he talks about, I'm a white guy that, is fairly privileged from the United States. So that's where I come from. And I am using my position. That's what he says. I'm using my privilege to try and talk about these things, right? Because I have privilege, and he recognizes that. And so let's talk for a minute about what was really important about what he says. I don't know if, let me see if I can, well, you have the book in front of you, right? Look at the cover of the book. Yes.
Well, the thing that really drew me to this was the Cornel West quote, powerful and timely. And I thought, oh, okay, I need to try to really read this.
I know, but it is hard. He like I'm going, and frankly, I was looking upwards, I'm going, what is he talking about? Right. So I don't want to go through each thing in the book, but I do want to spend some time saying, and this is what you hear on these panels and what you hear when he's talking, that he says, I picked the cover of that book because that is Plato's Caves. Now, see, he knows so much about philosophers and anthropologists, and he has references everywhere, right? I mean, he personally says that he would recommend a book called Blind Spot, which I don't think I have read. And so I'm going to look into that. But he says that picture on the cover, and so Plato's Caves had to do with Socrates having some conversation with someone else about what is truth. And so what he's saying is, if you look at all those different caves, okay, these people are actually tied. They are chained inside of these caves. So they can only turn their heads very slightly, but they can't move. And the center cave has that little ball that looks like it's got spicules sticking out of it. That's coronavirus. That is SARS-CoV-2, he says. And the rest of the caves are just other people living in their little silos, if you want to call it that. And then you have the social scientists, he says, which are the people that are walking outside of the cave, and they go into the sun, and they're supposed to find truth with a capital T. Right. And then they're supposed to come back and tell everybody inside the caves, well, we have found the truth. Right. But all these people are chained inside their little caves. And his whole point is that first of all, there is no truth with a capital T, and that everybody in their own little caves are actually there because they are choosing to be in their own little caves because of the ideology that they choose to accept and live with. So I said, wow, that's pretty powerful. I mean, in a way, maybe he's right that we label ourselves and we go and we find the people who tell us, I guess, what it is that we want to believe in terms of the interpretation of facts. But as he says, nothing is without interpretation. And when you don't recognize that you have an ideology and that you are putting those, what you perceive as facts into that ideology, then you don't see how you are tainted, right? And he says there is colonialism, and most of the time you had Europe going out and colonizing, but now you have coloniality. So even in his talks, he says, I need people to understand what are the important definitions that I have here. And so when he talks about coloniality, and he makes it a big point of putting that, in there, he says coloniality is really what happens after. Okay, so I don't remember what page it's on, but he describes it as coloniality can be described as the matrix of power relations that persistently manifests despite the former colonies' achievement of nationhood. So what he's saying is, you know what, all these colonies may have become now their own independent nations, but then he goes on to say the framework attempts to capture the racial, the political, the economic, the social, the epistemological, which of course, epistemology is the study of knowledge, right? So the epistemological, linguistic, and gendered hierarchical orders that were imposed by the European colonialism. And it transcended the decolonization and continues to oppress in accordance with the needs of the pan capital. So that would be economic, cultural, symbolic accumulation. Whew. I mean, he is so dense. It's like, my God, I can barely get through a definition. And, but he is saying, we haven't really changed. We haven't changed. People may have independence, and we may think that they no longer live under, colonial rule, but in a way we have structured it. And so he goes on to say that there are heterogeneous and multiple global structures that were put into place over a period of 450 years that did not just evaporate with the juridical political decolonization of the periphery over the past 50 years, that we continue to live under this same colonial power matrix. And the juridical political decolonization, with that, we moved from a period of global colonialism to what he's now calling this global coloniality. So the whole point is, oh, good, we have one other person, I'm Martha. So his point is, unfortunately, those people who were the colonizers continue to extract wealth from the colonies. And so what's happening is we want it to stay the way it is because that's how we continue to get the wealth. And so what he's saying when he says my ideology is radical social equity, he says, all these people, especially the epidemiologists, they study all these things in these other countries, but in the end, they are basically only looking at all the downstream stuff. And when he says downstream, he's saying, okay, and I need to bring this up. Do you remember that one study that he said was done on the HIV the couples, the people who had HIV in one of the partners, and they studied them to see what the transmission of HIV was, how relevant it was, or how much it would happen. And his whole point was this was a highly sought after and recognized study that everybody in the West, in the global North, he calls it the global North, right, thought was such a great study because we learned so much about the transmission of HIV. And he goes, we had drugs to treat HIV at the time that they did these studies. And what they did was simply observe transmission of disease. They did not intervene at all in trying to treat these people with HIV. And he said, where would that be allowed? Where would that in this country be allowed to exist? Nowhere. You think that passed an IRB, protocol? Of course not. But the point is, he's saying, but we allowed it and we thought it was a great study in this country because we say all these global South countries are just too poor. They're just too poor to get drugs. They're just too poor for us to be able to treat them for all of the diseases that they have. And guess what? We also blame them. We say, well, that's your problem because your infrastructure is so bad, right? That's your problem because you don't have a system of healthcare that allows you to help people. And his point is, but why do they not? So he's saying they're all looking downstream, but I am telling you, we need to look upstream and we need to say, well, the reason they don't have an infrastructure or a healthcare system that works is because we continue to take the wealth and we continue to exploit the countries. And he doesn't, well, Paul Farmer is much more careful about this. Paul says, I'm not going to attach any malevolent values to these people who do this because maybe they're not malevolent. I don't know. But he said, but I am going to say that there are people, and many of them humanitarian, right, who go in and try and help, but basically, and he says, and I'm not saying they shouldn't exist because we need people to take care of patients, right? We need people to take care of people downstream. So for instance, Doctors Without Borders or whatever, but it's not addressing the real reason for why this continues, these inequities continue to happen in the world. And until we can expose that, and that's what Gene Richardson is trying to do with this book. And he's trying to do it. I was saying, Martha, that it was really, he even says, I've listened to two of his, there are two YouTube videos, if you really want to understand what he's trying to get across, that he has a panel that he presented to the Global Health Department at Harvard, and then a panel that was done through Duke, because they also have a global health department. And and he makes it very clear, this was because other doctors said, this is so dense, it's very hard to read. And, it's almost impossible. I think that's why there's so few of us on here. And he said, well, I wanted it to be scholarly. I wanted it to be provocative. I wanted it to be, something that challenged people. And I didn't want it to be linear. He goes, maybe later I'll write something that's easier to read for the public. But thank you. If you got through it, I'm impressed because, I'm looking up words and I'm trying to figure out what is he talking about. You've lost me here. But so in listening to his talk, at least I thought, okay, now I know what the important points are here, right? Which are that he says, I come from this radical social equity ideology. And I think that even the people who are in the academic areas in our country do not recognize and do not point out when they are doing studies what these inequities are doing. And later we can have a conversation about this because, for instance, he says, he talks about Ebola first, and then we can talk about COVID, but he was in, many of the countries in Africa, Rwanda being one of them. But, he shows that article. I don't know if you remember that article where he said, here was a journal article published and people were saying, here is the super spreader, right, for the Ebola virus. And you show these two men in PPEs that are holding up this poor guy, right, that looks like he's almost dead. And they're labeling him, this man is the super spreader. And so what he says in these presentations is he says, you know what? this man probably spread Ebola to 5 people, right, in his community. And he goes, this man didn't have PPE. That's why he calls it. He said, instead of calling him super spreader, he said, maybe we should have called him that, the PPE deficient. He didn't say deficient, but the person, here's the person who didn't have all of the things that he could wear to protect him from getting exposed to Ebola. And he probably lives in a community where he didn't even, it's because we say, oh, people are ignorant. That's why they're not doing what they're supposed to do, right? Well, you know what? They don't know what they're supposed to do. And how do you know you even have it? And then you're supposed to stay away from your family and your friends. And they say, oh, they're ignorant and they don't go to the healthcare facilities that are treating Ebola. Well, think about it. It was just like here. These people would get taken to these tents, and then they would get isolated from their family, and then they would die, because most of them were dying because they didn't have any medicine, and they didn't even have fluids enough to give them to sustain them. So they knew that if they went to these facilities, they were all going to die. So why would you think that somebody would choose? And plus, the coloniality mentality, and we were just talking about what coloniality is that really we haven't changed any of the hierarchy from colonialism to when these countries became independent, right? So there's still that hierarchy, and they're saying we remember these people as people who always took care of themselves. Why should I trust them? Why should I go to them? Because they're just going to use me. And sure enough, that HIV study bears it out. They're just using us. They're using us as guinea pigs to find, and frankly, the Duke panel had on it that a man who's looking at reparations in the United States. And he says, that when I read that, I thought of the Tuskegee experiment. The Tuskegee experiment, they knew how to cure syphilis. They didn't treat these people. They just thought, well, we're going to see what the natural history, of course, is for syphilis, how much information we'll gather, right? I mean, it's as if people aren't people because they're poor, and because they are, maybe because of race, right? Differences in race. And then he makes, so that's his first biggest point, is when we do these studies, we don't even recognize how we are using our privilege, and how we are using the fact that we have taken advantage of these countries for years and continue to take the wealth, and we don't do anything about it. So the other point is that he is a part of the Lancet Commission on Reparations. So his major point is we cannot just continue to study or send people out and put little Band-Aids and make us feel good because we're just sending some supplies out there. We need to make reparations. And when he says that, and he says, but I'm not the person, I'm a person of privilege, so I should not be the one defining what those reparations are. So on this Lancet Commission, so far, I think they have like 10 subgroups. And on one of his presentations, he went through them, and I was going to try and look up what they all are, but I know that one of them is the U.S., the reparations for people in the United States who were descendants of slaves. And I mean, these people are very serious, this is, and he says each group has different ways of approaching how reparations should be made. They are not all the same. The ones from the US committee definitely are looking at saying, we think you need to look at how many people are left, and there's so many tens of thousands of people left that were descendants of slaves. Recognize that the reason that the people who have wealth right now have the wealth is because of the work of the slaves. And we need to assign a value, money. They're saying money because we need to redistribute the wealth. And that's the only way you're going to have equity, is if you give people the wealth that these other people have accumulated. So that's one committee. Other countries are not doing that. Other countries are saying, we want land. We want you to give us back land that you took from us, because that's how they're going to be able to continue to support themselves on the land. anyway, that is so that's one thing. And he's also saying, so we need to be looking when we are doing the research, and we need to comment on this is why these things have happened. He shows, and so one of his techniques is to take, for instance, that slide that said, when you have Ebola, this is what you need to do. And he put it on the left-hand side of the page. And it's like, get to the health clinic if you have cough, blah, blah, blah. And then he put right next to it, the one that he thought should be there that says, this is why people have Ebola, right? Because they don't have a healthcare system, because money was stolen from them, because this is what we have done to create this. And again, he keeps trying to say, we need to continue to say, when we have these articles published, why are these countries in this situation, and what are we going to do to change it? Because really the only way to change it is to get out of it, is to stop having coloniality. And I do think that we think as this colonial thought process, oh no, we need to stay because these countries can't take care of themselves. You know, they don't have the intellect. They don't have the epistemology, right? They don't have the knowledge. And he says that all the time too. Why do we think that we are the holders of knowledge? As if there is not just as much knowledge in the global South. And then he makes that point about the book that he put up, that there was that one book. What was the, there was a book by an African that was about this same idea of coloniality. And he said that book was published, I think he said in like 1965. And then he showed the book. And in fact, he says that's where he started getting interested in this whole area, because there was an American that published a book that had almost the exact same information in it that was published in the 70s, only he had some catchy title, and it sold a whole lot of copies, whereas the other gentleman's didn't sell much. And he said, basically, it was everything that was in this previous book by the African author. He never acknowledged that any of his ideas had come before the American author, that they were almost all in that other book. He never even said, hey, by the way, if you haven't read this book from the author in Africa, it was as if he had developed these ideas, and that this is where the seed of knowledge is, right? That we have this knowledge and that we are going to share it with you. So again, it's always about, you know, in his mind, it's always about a hierarchy, and that there is no equity here because we don't want there to be equity. So he's talking about Ebola, and then he moves back to COVID because, and in that too, he starts that whole conversation, which I thought was fascinating, because really I had been looking a lot at mathematical models of prediction. And I don't know if you know, like they would say, oh, well, if we don't mask and we don't socially distance, and if we have this many people, then we can expect this many deaths, right, to occur from COVID. Well, he just absolutely says that is so ridiculous. You cannot do mathematical model projections on diseases like this. He said, and for us to think that, and he hammered really hard against this IHME, which is Bill Gates' organization. And it's supposed to be, I'm trying to remember what it stands for, international health, whatever. They're supposed to be this great think tank, and where they're putting all this money. Oh, I should remember the IHME. But I mean, Gene Richardson, let me see if I can find it in here. I mean, he was like so down on it. Paul Farmer just said, you know what, I am not going to talk badly about Institute for Health Metrics and Evaluation. And they call themselves an independent global health research center at the University of Washington. And they are funded by Bill Gates, because a lot of it is models of prediction, right? So it's IT. And so he is saying, you know, this is just ludicrous. You cannot predict these things. And he said, mostly because it's going to be totally different. Like in the United States, who are the people that were dying the most? It was the people who were people, and we call it of color. I did love that on that Duke panel, there was the woman from Rwanda. And she says, she's a pediatrician and she's the vice chancellor of that new global health medical school. But she says, you people, you say people of color. And she goes, as if whites are transparent. That's what she said. She goes, you have color too, but okay, fine. We'll just go with the people of color. And that just cracked me up because it's true. That is what we say here, isn't it? And then I identify as a person of color, and I want to go, you're right. I mean, white is a color. But anyway, and not everybody, most people who are white are pink, or there's something else, or red or something else. But anyway, he was saying, the people of color, the people who don't have the space to spread out a distance, he says, what do you think? When we studied people, we said, what is the biggest thing that keeps you from isolating when you have COVID? And guess what most people said? He said, food insecurity. Food insecurity. And I thought about that because I thought, yeah, because if you have money, then either people bring you food, or you already stocked up on food, or you order online and they deliver it to your porch and you go outside, you pick up your food, right? But if you don't have the money, if you can't stock up on food because you're living from day to day, and you don't have anybody who can come around and drop it off, plus people live in huge group, a lot of people live together, it's not like many people here have huge homes and, just a few people live in them, or they have big backyards. That's why everybody left, New York, right? They were so tired of being inside their little apartments and not being able to go outside. And he said, you can't make mathematical predictions when you have people he goes, the countries, I loved this. He goes, it was obvious that the countries who have the most inequality had the most deaths from COVID. And guess who they were? The United States, he said, Brazil, I think England, and then there was another country. But he goes, the countries with the most inequality had the most deaths because the people without the way of being able to protect themselves from infection, and the original infection and Omicron, of course, were the worst, right? Because they caused all the lung problems. Maybe now the newer variants are not quite as well. The original Delta, and then, the original infection and then Delta were the worst. Omicron is not as bad. So, but because it's not causing as much respiratory, but he's saying, I mean, it was going to be clear what was going to happen. And he even said, he did say this too in one of his presentations. He didn't write it in the book, but he said, you know what? The reality is that even if Biden had been in the White House when COVID erupted, he said nothing would have been any different. He goes, because the point is that, you can have people saying whatever they say at the top, but when you can't get people the equipment they need, when you can't get them vaccines, and he goes, and that's the other thing, if you are in a country with inequality and you feel like you were a person that was experimented on, do you think people of color are going to rush over to get vaccinated? Probably not, right? And so, I mean, we tried very hard to get people to come and vaccinate in Knoxville, and we did that by going to them, by explaining and saying, we do think this is going to be helpful for you. Knoxville actually did pretty well, really, if you think about it in terms of vaccination rates. But that's because there were people of color that were going out into the community and saying, trust this, trust us, which, sometimes it is a hard sell. But so again, I thought that was fascinating, this whole idea that it really, in the end, it's not about mathematical predictions, it's about inequality, and it's not going to matter. So we need to do something on the ground that changes the healthcare. It's not just the healthcare system, it is the system of wealth and lack of wealth in this country, right? So he's specifically speaking to that. Now, he doesn't have all the answers. I mean, because people keep asking him in these panels, well, what would you suggest? What would be the next step that we should be doing? And he goes, well, I guess the first thing is, if you are one of these people that are doing the studies, then you need to start publishing. And he says, my articles don't come out in the journals that everybody else is reading that are the most prestigious, right? Because they don't want to publish his articles, right? They're going to publish the articles that are more standard. And he says, so I would hope that, number one, we start, all of us in academia, talking to one another in different disciplines, because again, he's saying social science, like he says, economics is a social science, epidemiology, other than the facts of, how many people, okay, here's his point. You can, for instance, say, I am going to study how many people that are African American, and we do it all the time. We're dividing, like how many have, let's say, preterm labor, right? How many die, in during pregnancy and at delivery? What is the infant mortality rate, right? And we do try and separate it by race, although it's getting a little more difficult. And what do? He says, we say, okay, here it is. Here are the differences. And that's where we leave it. All these people are doing all this research, all this study, and they find it and they say, I'm publishing this data. But why are we not doing something about it? That's what he's arguing. That's great. But how are you changing the system so that we don't keep reporting on the inequalities? And so he just, he says part of it is you have to put it in people's faces, right? And the woman from Rwanda that was on the panel at Duke said, I still think it's education, education, education. It's us educating ourselves so that we can start questioning, because his point too is that it's all about perception and coloniality. It's the same idea that I think that we would know it as internalized oppression, right? Internalized, that if you come from where you were treated badly, you begin to believe what you were told about who you were, right? And who you are. And that is still happening under coloniality, that it's like, hey, are we capable? Do we know as much as the people that ruled us before? So they don't trust themselves. So this Rwandan physician is saying, we are intentionally bringing people into our medical school. We require them to get a master's in global health, public health, at the same time that they get their MD degree, because you cannot be a physician without understanding, she's saying, especially in the global South, what is happening and why it's happening. And then we're going to move those people around. They may not stay here in Rwanda. We are going to move them all over the world, and we are going to try and affect change that way. And in a way, I mean, I know a lot of people think that Cuba is very repressed and has, a repressive regime, but not everything is fantastic in Cuba, but I will say that that's exactly what Cuba did. They trained their physicians and they sent them out into the world to help other countries have some health care. And they took people from other countries into some of their educational system in order to train them too, but then they sent them out to train elsewhere. And I think that that's what they're talking about, right? With the idea in mind that we are not here to tell you how to do things. We are not here to try and establish the same structures that are built on the hierarchy. That's not how we need to do this. And so that's his major point, I think. We need to look at reparations, which is why he's really big on this Lancet Commission. And, I thought it was interesting, though, to me, that Paul Farmer is the chancellor of this global health medical school in Rwanda, because and I love Paul Farmer, and that man has done incredible work all over the world, and he's brilliant, and he is the chair at Harvard, so that brings with it, some credibility for sure. But I still think, why is he the chancellor and she the vice chancellor? He doesn't even live in Rwanda. She should be the chancellor, and then he could be the visiting scholar or something. But, it starts, it has to start small, I guess. But, it made me rethink again. It does. It makes you rethink again. So what as physicians, actually, it made me realize that, gosh, maybe I'll go get a master's in global health. But, and because it's just like, as if I don't have a million other things to do. But because it's a paradigm. And I also recognize this. He says himself, I am lucky to be here with Paul Farmer. Somehow they're being allowed to stay, okay, because they haven't changed. I mean, I think they're probably very separate from, I'm sure they are, from the medical school itself and from the siloed researchers that are there. And, and I have always felt like, I mean, anything could change in a heartbeat. The instant that you do something that is more provocative and more challenging, they'll cut you off, and so then you either just go do your own thing, but you want to stay within the institution to try and change the institution, right? But sometimes it's hard. But right now they're doing great work, and they're brilliant people. So maybe that's also with credit. I mean, look, he's got a Duke undergraduate degree, a Cornell MD degree, a Stanford PhD degree. I mean, the guy has a resume that you cannot fault, right? So that's probably also part of why. And he met Paul Farmer when they were working on Ebola. That's where they met, actually, was in Africa. And they became really good friends. He mentions, a book that Paul Farmer had just written, and he mentions, I'm going to read that blind spot, but he mentions many other, but I'm going to stop talking now and say what, and I mean, he has a million references. This book is so dense. I mean, really, I wanted to say to him, write that book for the public and I'll read it too. Because actually it was the two physicians, the Rwandan lady said the same thing, actually. And so did the African-American doctor that was saying he's on this reparations committee. He just said, let me tell you, I got to tell you, Gene, that's what they call him. This book is tough. This book is tough, but when we finished it, we knew how important it was, but it's not easy. And so questions, discussion, we don't have too many people, but tell me your thoughts. I'll be quiet now because we only have 10 minutes. Come on, Carol, Martha, you guys. Unmute.
Well,
I want to hear what Martha
I wasn't
says.
smart enough to read this book. The preface was the worst part. Once I got through the preface, I thought, well, okay, I'll keep going. But it was fascinating and yet overdone for me. He had made his point for me halfway through that book, although I came as a believer to begin with. So maybe that makes a difference, but that's kind of where I was.
Okay. Yeah. Carol?
Well, and on the book itself, I really had trouble trying to understand it. I thought, well, this just isn't my field. I don't even understand words. And then the graphics would jump all around. But I guess like Martha, I mean, I kind of started as a believer, and then to see the facts and the studies, it was still pretty shocking. And it reminded me of Henrietta, what's her last name, who they took her
Henrietta
cells
Locke.
and studied them for cancer. Yes. Now maybe the family is getting a little money, but I mean, in this country we've just killed people, and studies that have been done, and so when I was reading about, I thought, yeah, if I was one of them, I wouldn't go to a clinic. I mean, if I lived there, knowing the history, I mean, why should anybody trust, the U.S.? So I'm glad that somebody's working on redoing the whole thing. I don't know how it's going to be done, but I think reparations are definitely in order. But locally, is it Vivian Shaw? She's the one who is that the woman, the African-American woman who went into the community here in Knoxville, people vaccinated?
Yes.
I was at a party with her and I can't remember her name, but So I will be glad when he writes a book for the public. I mean, I think that would be really,
Well, and
really helpful.
yeah, and
But I mean, I don't know what, I mean, it's very shocking.
I agree.
So anyway, and I've got about 40 pages left. I haven't finished. I've got about 40 pages left of the book.
I thought one of the most telling things was the 9 patients with Ebola, the Americans that they brought back to the US, and all of them survived, obviously because they got the right care. And that
There
was
you
just
go.
amazing.
Yes, exactly. So you go to a country who has the resources, and think about this. You tell people to go to healthcare clinics and they have to walk 3 days. I mean, because they don't even have healthcare clinics around them. So how do you expect people to do this, right? And they're dying because they don't have resources, right? I know. And it is so easy, I think, for us to forget people in the world. I mean, like, oh, well, I don't live there. Those aren't my circumstances. Too bad. I mean, I think that's almost like that's what he's saying is we almost totally discount these people as human beings. Why do we think that's okay?
Yeah, yeah,
Mhm.
It's not okay. But I think if you listen to his
yeah.
videos,
And
listen to his interviews on the
I want to
YouTube,
do that.
Mhm.
especially the Duke one,
Yeah.
the panel. That one.
Well, and I don't know, but I don't know. I mean, what can be done? It makes me feel very helpless. I mean, it's a horrible situation, globally and in this country. But I mean, so he is exposing the problem. But then what can be done? I mean, first of all, people's minds and hearts have to be changed. But then what do you? It's kind
Well,
of feel
maybe
helpless about it.
yeah, I agree. But maybe, see, I had never really thought that much. I'll be honest with you. When people talk about reparations, and I'm thinking, well, what is that going to do in terms of money? And are people going to even be able to use that amount of money if they just don't get enough to do anything? And then I thought, but maybe that's what we ought to help to get these things passed. I mean, the other thing the Rwandan physician said is you need the legal support too, right? You need to get things done through the courts as well to require this. So she says, I will go in front of anyone to get my point made. And so maybe that's it, that we go and say, okay, what are you working on? Like for reparations, maybe we find out what that committee is and say, what kind of help can I give you? What do you need? Because really, that makes sense to me. If we need to do something about it, because I keep thinking, how do you change? Well, of course, they want to tax all the super rich. Well, I'm all for that. But I mean, how do you get that done, right? I mean, so so maybe that's it. You go and you say, what are you thinking? Where do we need to start? What can I help with where I am, right? Of course, then I think I can't even change, the legislature about the trigger ban, on abortion. So then I think, well, I don't know how that's going to, but you got to work and keep working. You pick your lane and you just work at it. But I agree. It's depressing. Well, that's why I thought for me, it's like, I'll go get some more education, but that doesn't change anything. I mean, that doesn't change anything.
What about, instead of slamming people like Bill Gates, why can he not try to work with those people and bring them around to his point of view?
Yeah, I agree with that too. Right, exactly. And see, I think that's why Paul Farmer was much more cautious. He goes, I do not want to, because he made a comment about, and then the malevolent. He goes, wait a minute. I am not going to attribute any motives to anyone because I don't know those people.
Mhm.
And it was true that
Yeah.
Jean did say, these are racist things, but I am not calling the people who are doing these things racist. I just think they don't recognize that they are perpetuating the system. But you're right. That actually makes sense to me. Instead of and so Paul Farmer said, I am not going to, denigrate IHME. I'm not going to do it. And so I thought, okay, good. I didn't know whether he was not going to do it because he wants a good relationship, but I think you're right. If you start putting everybody in a bad space, then you're never going to have a dialogue, right? And maybe that's it. You say, let's have a conversation, about, because you got all that money. Maybe we ought to look at how you can use it here, and instead of analyzing stuff that's probably not very useful anyway. I like that. Well, maybe that's what we do. We say, we just read this book and we heard about you, and we're thinking that we want to have a conversation about how you can use your funds in better ways. Let's talk about that. I like it. All right. Well, I think I picked I thought, oh my God, I wonder if anybody's even going to show up for this. But I do know one other person who read it, but she couldn't make it to the book club. And she said, oh my gosh, Rocio. And I said, I know, I should have read the book before I put it on the list. But then after I read it, it was too late because I'd already sent out the thing, So, and I think it's an important point. I mean, that is really important.
Oh yeah, I'm glad you picked it. Yeah, because I mean, I obviously wouldn't have read it. And I kind of halfway expected Fran to be on here.
Oh, well, maybe she's busy. Maybe she's busy. That's okay. Anyway, all right.
Yeah.
Well, you guys.
But no, I think it's good.
All
Thank
right.
you.
Thank you.
I'm gonna watch the videos.
Thank you.
Yes, that'll be good. All right.
Thank you.
Bye-bye.
Have a great rest of the week.
Bye.